Now, one of the reasons we're doing this today is because you've described a lot of advances recently in the science and understanding of medicine of CRPS. Can you tell us where we are now and what it looks like the future holds for this?
Sure. When I first went to school and I started learning about this in residency and everything, we thought that CRPS was simply a sympathetic nerve problem. As I have gotten to know more and more, and I have seen more and more research coming out, we understand that it is not just a sympathetic problem, and if anything, the sympathetic is a secondary issue to the problem. The problem is more of a localized problem, it's a central problem. Where we are right now is in not only trying to understand it further, but as far as treatment is trying to figure out how does the immune system is involved with this. There are researchers in Europe and in California that are beginning to use medication that modulates, medication that actually stop and address the immune system of the body. For example, I just read an article a few days ago about a researcher who's beginning to use a medication called Remicade that is typically used for people that have lupus or rheumatoid arthritis. And I questioned, when I saw the title, I'm like, But when you go into the article, you realize that this researcher really is at his forefront, he's cutting edge. Because he's beginning to understand that perhaps the reason why this disease process, this condition persists, is because the immune system is maintaining it. And also, at a conclusion, he challenged all of us, hopefully himself, because he's the one doing this, to begin to look at the immune system and also the human genome. So that perhaps those patients that develop this fulminant problem, there is a genetic predisposition to this problem. So where this disease process is going, treatment-wise, the research is heading more to looking at the cellular DNA process, how does the body respond to the trauma, and in particular, I'm trying to understand why is the body so involved in certain amount of patients and not other, which tends to suggest that if you develop complex regional pain, perhaps there is something innate to you as opposed to this other individual that receives the same trauma but doesn't develop it. So there's a lot of research. So far, the problem that we have treating complex regional pain is that our treatments are terrible. We really don't have anything. We're trying to just throw a little BB gun at this monster of a problem that we have. Because one is that, as well as I think that I understand it, I still believe that we don't understand it completely, and more research needs to be done. And two, like any other disease in the body, even when we understand it, we still don't have the medicines and the appropriate treatment to try to control the disease. So all we do is we try to temporize it. I'm going to give you a week of relief, 2 weeks of relief, but I don't have the cure. I don't know how to go to your brain and shut these connections out. We don't have the technology to do that. So I give you pills to try to do it from the outside, and that creates a problem.
Suffering from pain? Come find relief at Hyde Park Pain Management. Patients from all over Boston and the New England area come to our state-of-the-art medical facility to be treated by our world-class physicians. Each one is board certified in pain management with extensive experience treating a wide variety of conditions, including back pain, joint pain, arthritis, migraines, sports injuries, work-related injuries, and motor vehicle accidents. We offer flexible appointment availability, acceptance of most major insurance plans, easy access to public transportation, and free parking for our patients. Plus, our expert physicians speak several languages, including Spanish, French, Russian, Ukrainian, and Arabic, to even better serve patients with English as a second language. To learn how we can help you manage your pain, visit our website or call 617-833-6100 today. Hyde Park Pain Management. Relief is here.